A bold proposal in Prince Edward Island could make that province the first in the country to ban tobacco for anyone born after a certain date. If the idea goes ahead, the government would select a year, for example, 2009, and anyone born after that would be prohibited from ever legally buying tobacco products on P.E.I. The plan drew mixed reactions from Islanders.
It's good. I think it's really good. I think, like I was saying before, we should just outlaw cigarettes altogether and be done with it.
In theory, it sounds good, but they're using words typical of the tobacco and drug industry in terms of a harm reduction philosophy, in that they're talking a tobacco generation ban, but they're excluding all us adults.
It would definitely get more people active and more out in public and using our trails and everything.
Dr. Heather Morrison is P.E.I.'s Chief Public Health Officer. Dr. Morrison, welcome to the show.
Thank you for having me.
So the proposal on the table here is a lifetime ban on tobacco for residents born after a certain date. I mean, how close is this to becoming reality, and how exactly would this work?
Well, I think it's a bold and ambitious plan for really a bold and ambitious goal for us in P.E.I. to make sure Islanders and thousands of Islanders are empowered to breathe well by living tobacco-free. And we know that tobacco is the #1 preventable cause of illness, disability, and death in our province and many other jurisdictions across the country. So I think we need to be bold and ambitious. But at this point, it's being put out as one of the plans, or part of the plan for consultation for Islanders, because we do want to hear from Islanders also about what they think about this moving towards a tobacco-free generation.
So what's the ballpark you're looking for? Because I've seen proposals in the United Kingdom where I think the cutoff is 2009. Anyone who'd be 15 roughly and younger now there'd be a fine in Wales or the UK if you buy it of £100. Is that sort of the timeline and the system that you'd be looking at there in P.E.I.?
Yes, a very similar kind of system, and the UK did pass very similar kind of legislation I think over a month ago, and it would be so that my youngest children, for instance, would not have that option when they are 21 to purchase tobacco. Now, P.E.I. was the first province, first jurisdiction in the country, I believe, to increase the age where you can purchase to 21 a few years ago. And so we know that we want to limit the initiation of youth starting tobacco, and this is something that has gathered interest really across the world, and it's an important conversation. And if we do this, we are going to save many lives on P.E.I.
It's been a long, long time since I was in this youth demographic you're targeting here, but I remember when growing up, when people got their first cigarette, it's not something they went in and bought legally, right? Because they were underage even then, and so it was either illegal cigarettes or handed down from other people. So, like, how do you interdict that? You know, I see how stop at a point of sale, but that other, I don't want to call it a black market, but you know what I'm talking about.
Well, I think the contraband is always going to be an argument, and we expect that. But we know that regulation has really made a difference over time, because the contraband argument is always there, not just about cigarettes, but about many things. So, but we know that regulations have made a difference despite that argument. And we certainly expect to hear some of that in our consultation. And that shouldn't stop us from hearing from everybody. And, you know, there's not many smokers who you speak to, and certainly the evidence would also suggest this from surveys across the country, that people wish they had not started. They wish they had never initiated smoking. And it is the rate of smokers in Prince Edward Island certainly has come down, but it has almost started to come down so slowly, and almost leveling off. So I think this is something that might really make a difference. And our job is to protect and promote the health of Islanders. And this is a bold and ambitious plan to see if we can do that.
Right. So the rate of smoking has gone down, but it's kind of plateaued, and you feel this is a way to further drive it down even further. But I wonder, Dr. Morrison, like when I see, I don't know, I don't want to sound like the old man, when I see kids today, I don't see them smoking cigarettes. I see them vaping, or I see them using the electronic cigarettes. And there's a lot of studies on the health implications of that and how that's habit forming and introduces them into worse behaviors. This strategy only takes aim at old-fashioned cigarettes. Why not also look at vaping and other products like that?
Well, I think that's an excellent question. And I anticipate we will hear some of that as well on as part of the consultation, because we are concerned with vaping, especially amongst youth. We have a huge wealth of evidence around tobacco, and I think we're starting to get more with vaping, but we still know that smoke or tobacco is our number one cause of preventable illness, disability, and death in the province. And so that's why the focus, similar to the UK, where they have focused on tobacco, at least to start with,
Right.
has been in place. But we are certainly open to hearing from Islanders about vaping as well.
Well, you mentioned the consultations now a couple of times. As I understand it, they're going to run until about the 5th of July. So a lot of time to hear what Islanders have to say. But what's been the response so far? Is your sense that people are generally positive with the idea of just forever stopping the next generation of smokers from becoming a thing?
Well, I mean, I haven't had a chance to go and review all the input to date, but certainly there's been tremendous interest and lots of responses already. And the interest has been, at this point, more overwhelming in favor of understanding where we could go with protecting our youth and protecting our whole population. Individuals who smoke tobacco in our province, on average, live 10 years less than those who do not smoke. There are huge economic and social costs of tobacco in the province in terms of healthcare, lost productivity. We have hospitalizations, deaths. So this is something that we should be talking about, and we can make a difference in the course of having a generation that may not have tobacco the same way we were exposed.
Dr. Heather Morrison, I want to thank you for your time today. We appreciate it.
Thank you very much.